Thanks so much. So I'm Sally Thibault. I'm a professor at the Liverpool School of Tropical Medicine, and I'm delighted to have the opportunity today to discuss with Dr. Sia Tengby about the dissertation and the research that she did at Liverpool School of Tropical Medicine on delivering healthcare services during an outbreak, the psychosocial impacts of the COVID-19 pandemic and the Ebola outbreak on healthcare workers in Freetown, Sierra Leone. And it's Mental Health Day, October the 10th. The theme of Mental Health Day is mental health for all. And Sia, it would be brilliant to hear from you about your dissertation, what you focused on, what you found, and what the implications are to support psychosocial health and mental health of healthcare workers in Sierra Leone. So over to you. Please start by introducing yourself.
All right. So Dr. Sia Tengby. I'm a Sierra Leone medical doctor, and I would like to share some of my findings and recommendations from the study I did to fulfill my master's degree at the Liverpool School of Tropical Medicine.
Great, thanks, Sia. So could you start by sharing your aim and objectives with us?
As we all know, the COVID-19 pandemic has had a tremendous impact in all areas of our lives. And this theme, mental health for all, prioritizes the need to focus on mental health, especially for healthcare workers who have been providing care during this challenging period. So the aim of my study was to explore the psychosocial impact of the COVID-19 pandemic and the Ebola outbreak on healthcare workers in Freetown, Sierra Leone, and to develop recommendations for appropriate support. These are my objectives. So the study was a qualitative study, and I did 13 in-depth interviews with frontline healthcare workers, members of the National COVID-19 Emergency Response Center, and heads of facilities of COVID-19 treatment centers to be able to ensure that I pull and the experiences and the different view of the different participants that I talked about. I had to conduct my study remotely from Liverpool due to the travel restrictions and COVID-19 social distancing restrictions in place, and I had to rely on my established network to be able to recruit participants. In terms of the analysis of the data I collected, I used the framework approach, and it was an iterative and ongoing process. And my coding framework is shown here. And I would like to share a few of the quotes from participants that really resonated with the theme and actually highlights the need for more support for mental health, especially in healthcare workers who are often overlooked during this period. One of my favorites was a participant, a male doctor, who said that the colleagues were scared of us, knowing that being at the front line, we are at risk of becoming infected. In fact, they're also afraid of us. They told us not to come close to them. This quote highlights the importance and the kind of the stigmatization and the isolation that healthcare workers are facing, even though they're trying to render a service. They feel weak, they don't want to go to work, but they have to remember that they are fulfilling their duties and they have to go to work. And in Sierra Leone is especially important because we have gone through the Ebola outbreak, mudslide, flooding, and now the COVID. And even though we are resilient, it should not be taken for granted because people are traumatized and full of anxiety, and it's like no one is hearing the needs of healthcare workers. So based on the findings, I'd like to talk about some of the key themes that I pulled out in the discussion. And it's healthcare workers are afraid of infecting themselves and their loved ones, and they're exhausted, they're isolated, and they experience so much stigma trying to provide care for COVID patients. And this is especially more relevant in female healthcare workers and nurses due to their contact with patients. The pre-existing challenges in the health system in Sierra Leone, such as limited human resource, lack of medications and equipment, also seem to exacerbate the psychosocial support. However, some lessons from Ebola ensured that there was early training and there was enough PPE to ensure, which helped to reduce their fears. And then also, but the sad thing, there was no psychosocial support for healthcare workers. So they had to rely on peer support and religion and their sense of duty to be able to pull through and cope during this challenging time. The prior experience with Ebola actually came in handy and was crucial for the healthcare workers' outlook, because a lot of them expressed that they were more confident and better prepared to be able to tackle these challenges, which is suggestive for signs of resilience, especially given the trying circumstances they have to work in. However, the emotional and psychological trauma cannot be underestimated because signs of it still exist. So based on all of this, I pulled together a couple of findings that speaks to the need to improve psychosocial support for healthcare workers. And then these were kind of divided into ones that really target psychosocial support, which is to make sure it's included in outbreak response, to train healthcare workers to be able to cancel and then to build on existing structures in the country that were set during the Ebola outbreak, to supervise staff appraisal. Trainings are also very crucial. And also, given the limited and often challenging to draw up finances during this process, it's also important to formally recognize healthcare workers, like through awards and certificates, which helps to boost their morale. And we should not forget that frontline healthcare workers, especially nursing staff, that are also have the most contact time with patients, should be targeted and attention to be paid to them, most especially. Improving the health system also helps, because when you strengthen the health system, it improves the effectiveness of healthcare workers, and also bringing creative ways to just keep healthcare workers informed through scholarship, career advancement opportunities, and health insurance scheme also shows that we care for them and we want to improve their working environment. Finally, I would like to thank all frontline healthcare workers all across the world, including Sierra Leone, for their dedication and their time in providing service during this trying time. And also, we should remember that health is incomplete without mental health. Thank you.
Really clear overview of your findings and the importance of mental health for Mental Health Day.
Yes.
And as you say, healthcare workers at the forefront of the COVID-19 response, very much in need of psychosocial and mental health support. So the recommendations that focus specifically on healthcare workers, excellent. And then you're saying that healthcare workers' mental health is also inextricably linked with the health system, and strengthening the health system will also strengthen and support mental health. And you explained about the particular unique circumstances of Sierra Leone in terms of exposure to previous epidemics and shocks, and how that brings both resilience but also anxiety and sometimes unresolved trauma. And
Yes.
So the real importance of investing in psychosocial support. And as you brilliantly summarised, health is incomplete without a focus on mental health. So really clear overview for Mental Health Day and bringing the mental health of healthcare workers to the forefront around the world. Thank you so much.
Thank you.